Well, injury is the leading cause of death for Hoosiers under the age of 45. A key weapon to battle these untimely deaths is a robust statewide trauma system, which Hoosier public health leaders say Indiana lacks. Business of Health reporter KYLIE VELETA tells us about continued efforts to change that. KYLIE.
That's right, Gary. Hoosier public leaders say Indiana has several pieces in place for trauma care, but those links aren't connected to form a strong chain that would make up a statewide trauma care system. However, they're pushing for change. Public health leaders are championing a new bill this legislative session that calls on the state to study Indiana's trauma system. And leading the charge is Merry Addison, a lifelong ER nurse and Indiana Rural Health Association board member. She joins me now on the show. Meredith, thanks for being on the show today.
Thank you. Thank you, Gary.
Absolutely. Before we talk about the bill, let's talk first about the current status of trauma care here in Indiana. It's inconsistent at best, probably would be the best description. And a lot of it depends on where you live. In rural areas in Indiana, probably face the biggest challenges. Can you explain some of the trauma care challenges that are unique to the rural areas in Indiana?
Well, there are things called time-sensitive diagnoses. Heart is a time-sensitive thing, stroke is a time-sensitive thing, and trauma is the time-sensitive thing that deals with the young people. So in years of public or productive life lost, trauma takes out far more than all the others. So it's the time.
Right, and with rural areas, they just don't have the close connection to a hospital, right?
Well, the hospital may be wonderful, it may be there, but do you have cell phone connectivity? Does anybody have a cell phone? Did anybody know that you were out in the pitch black and had some kind of life-threatening injury? So those are the kind of things I'm talking about, the links not being fastened tightly.
Okay, so let's talk about this bill. It's being sponsored by House Representative VERMILION. She's from Northeast Indiana. And this bill is to study Indiana's statewide trauma system. Dr. Paul Halverson, he's throwing his support behind this bill. He's a widely respected name in the state, of course, Dean of the Fairbanks School of Public Health at IU. Explain, why is studying the trauma system an important first step?
Because we live in Indiana. If we even knew there was a problem, we'd step up and fix it. That's the way Hoosiers roll. But if it's kept in the silo instead of shared in the network, then how did you know your neighbor even needed you or their kid was upside down under their pickup truck? It's a matter of sharing the information, every link of the chain.
And so what does it do to have that bill? Does it just help with public awareness, help get the word out?
It makes it official. The State Department of Health and the Department of Homeland Security, the State Medical Association, the State Nurses Association, the Emergency Nurses Association, all have public policy platform including this. But it's not all the pieces all the way down to the volunteers at your neighborhood.
Right, and just Dr. Paul Halverson, he said the statewide trauma care system needs a serious look for system innovation and modernization. So there's no funding yet assigned to this effort, but you say a really important ripple effect of this bill could be capturing the attention of some of the deep philanthropic pockets here in Indiana. Explain what you mean by that.
My papa worked at Lily's for 38 years. He drove a fork truck and he loved what he did. He said Indiana had the deepest philanthropic pockets in the global world until Gates came along. And so we're no slouch. We've got all the pieces of the puzzle we need. We just need a heightened awareness so that your neighbor knows you need your help.
So as you know, Indiana's in a deep public health crisis right now. So does the pandemic help your mission in some way? Does it help kind of light the fire for this bill in some way?
That's exactly what it did. It illustrated that there are places where there are gaps that people didn't even realize. In order to be cell connected, you have to be parked outside somebody else's business in their hotspot or whatever you call it. Well, we've got hotspots in the community, and the gaps are where we're losing people. You just need to bring up awareness and tighten up the gaps, link up the links, and make everything work.
Okay, and Mary, I know you are so passionate about this topic. You've been an ER nurse for, if I'm doing my math correctly, close to 45 years. Why is this topic so close to your heart? Why do you care so deeply and want this to happen for the state so badly?
I am on the other side of the desk in the place that's open 24/7, 365 days a year. And I have held in my arms what other people don't even have accurate nightmares about. And so we can avoid that for people. And I know people would step up and cough up something to make it work. So it's not a matter of funding, it's a matter of heightened awareness.
Okay, we only have about 30 seconds left, Mary, but this same bill died in 2017. What do you think will make it different now in 2021?
Dr. Paul Halverson's already done this in Arkansas, and I told him they have just as many jokes about Okies as they do about hayseed Hoosiers. All we need to do is just shine up the links and link them together, and we've got all the resources we need. We just need to do it.
Right, I know Dr. Paul Halverson really changed the Arkansas trauma care system, so he's cut his teeth somewhere else. So, Mary, thanks for being on the show today and giving us some more insight to this bill, and we'll be following it and appreciate you being on the show today.
KYLIE, thank you. Gary, thank you.
Absolutely. Gary, back to you.